My name is Marie Fowler. I'm a medical social worker, and I've spent a lot of my career working with seniors who have been diagnosed with life-threatening illnesses. I think we can all agree that healthcare is a necessity, especially for the elderly and the disabled. But I think a lot of us take Medicare for granted. Without it, these people wouldn't be able to obtain private health insurance because they would be disqualified because of their pre-existing conditions. And also it would just be too expensive for them to afford. But it's not just seniors and the disabled who struggle to afford private health insurance. Studies show that in 2020, the average cost of health insurance for individuals was nearly $500 a month and $1,200 a month for families. What the pandemic has taught us is that the health of one affects the health of all. No matter how much money you have or how nice of a neighborhood you live in, it's not possible to live in a bubble that would protect you from a deadly virus. Your health is tied to and depends on the health of your community, which is why we need a national health insurance or Medicare for All. The United States is the only industrial country in the world that does not have and does not provide universal health care to all of its citizens. A recent Yale study found that the death rates from COVID-19 in the United States are higher than in any other developed country. Without adequate insurance coverage, individuals are more likely to postpone treatment for infections or other health care issues. If the United States had a single-payer universal health care system, more than 339,000 lives could have been saved since 2020, meaning that these could have been preventable deaths. In addition, the country would have saved $105 billion just in COVID-19 hospitalization expenses alone in that year. The research further determined that even in a non-pandemic year, $438 billion would have been saved by single-payer universal health care, and 200,000 Americans won't have to file for medical bankruptcy each year. These results make it a powerful case for healthcare reform. The head of this research, Dr. Allison Galvani, the director of Yale Center for Infectious Disease Analysis, said, "Americans are needlessly losing lives and money. Medicare for All would be both an economic stimulus and a life-saving transformation for our healthcare system." Far from financially burdening the nation, universal single-payer health care would not only have saved lives, it would have also avoided hundreds of billions of dollars in costs. Medicare for All would reduce costs by improving access to preventive care, reducing administrative overhead, and empowering Medicare to negotiate drug prices. Single-payer health care would also eliminate pricey insurance premiums and reduce fraud. The United States currently spends more on health care than any other nation, both per person and overall. Despite such heavy spending, the piecemeal nature of the United States medical insurance system worsened COVID-19 effects. Again, many people without access to adequate health care delayed necessary medical treatment, postponed being in medical isolation for safety, and kept working when they felt sick. These factors fuel infections and deaths. Most Americans rely on employer-sponsored health insurance plans, with each enrollment typically covering more than one person. And yet our current system still left 41 million Americans uninsured before the pandemic. Then, during the pandemic, over 9 million workers became unemployed. As a result, many people, and in some cases their entire families, lost their insurance. Medicare for All would save lives in a number of ways, according to the researchers. It would cover everyone's health care for less than the current cost of only covering some Americans. It would make it easier to access primary care, which helps people prevent or stay on top of chronic conditions like diabetes or high blood pressure. Such conditions can raise the risk of death, including from COVID. It would lower financial hurdles to seeking care for illness, and it would support rural health care facilities and ease pressures on hospitals that are forced COVID infections rage. Dr. Galvani said, universal single health care is both economically responsible and morally imperative. So again, we start by protecting the Medicare we do have. Tomorrow, in honor of Medicare's 57th anniversary, there will be a march and rally for Medicare For All in Washington, D.C. Our local call to action from the media is to help educate and warn the public about direct contracting entities, also known as Medicare Reach. Our call to action as citizens is to sign the petition demanding an end to this at protectmedicare.net. Again, that is protectmedicare.net. You may also wish to call your members of Congress at 202-224-3121 and ask that they protect Medicare from DCEs and also to support Medicare For All. Be sure to let your family, friends, and colleagues know about this ongoing threat to traditional Medicare.